Okay, this is a neuro assessment for Health Assessment 2. I'm going to introduce myself. My name is Brenda Lynn. I'm going to be your student nurse. I'm going to provide privacy, and I'm going to do 2 patient identifiers. I will ask her for her name and her birthday. What is your name?
My name is Crystal Williams. My date of birth is 10/4/1995.
Okay. Now I'm going to assess orientation to person, place, time, and situation. So can you tell me who I am?
You're my nurse, Brenda Lynn.
Okay. And can you tell me where you are?
I'm in the hospital.
Okay. We'll say that. And can you tell me the month and the year?
It is March. Oh no, it's April 2020.
Okay. And can you tell me why you're here?
For a neuro assessment.
That's right. It is April Fool's. Awesome sauce. Sorry. I can tell that she is ANO times 4. She is awake, alert, and oriented. So times 4. There we are. I'm going to assess her mood based on the way I'm looking. Sure, her mood is appropriate for the situation. She's answering my questions, so I can understand that she has cognitive ability. Yeah. So I'm going to take never mind. My goodness, excuse me. As I'm observing her posture and energy level, it's appropriate for what is going on. Her dress is appropriate for the season, and her speech is clear. I'm going to go ahead and assess cranial nerves now. So I'm going to do cranial nerve 1, olfactory. So I have a scent here, and I'm going to have Carissa sniff it and tell me what she thinks it is.
It smells like coffee.
It's coffee. All right, now we know her nose is intact, and that olfactory nerve is intact. She can sniff and smell things like delicious coffee. The next cranial nerve is cranial nerve 2. It's the optic nerve. If I had a Snellen eye chart, I would do that. But I also have the equipment to do a confrontation test, so I'm going to go ahead and do it. I'll be kind of like in front. I want you to go ahead and cover your left eye, and I'll do the same. So I want you to say now when you see my fingers, okay?
Now.
Okay. Go ahead and switch eyes.
Now.
You're supposed to.
Now. I don't know. Okay. Now.
Okay, that's finished. Pretty good. I'll let that pass.
I'm blind.
Okay, now I'm going to go ahead and assess the nerves 3, 4, and 6, which are ocular, motor, trochlear, and abductus. So first I'm going to assess for pupillary response, or PERLA, and check a combination, as well as going through the 6 cardinal fields of gaze, or the wagon wheel method. So here we go. First I'm going to check her pupils. So as I'm looking at her pupils are round and they're the same shape. Now I'm going to check to see how her eyes react to light. So I'll have that in front. I'll come to the side. Highlighted. And there we are. That looks good. Her pupils are reacting to light. I'm now going to test accommodation. So I want you to look at my pen, and I want you to follow it with your eyes, okay? Okay. And accommodation is good as well. I'm now going to go into the 6 cardinal fields of gaze, the wagon wheel method. So I want you to keep your eye on my pen. I'm going to move it in different directions, okay? All right, and all of her eye muscles seem to be intact because I didn't see any abnormalities with her eyes as she was moving them around. Her no drooping in her eyelids and all that. So now I'm going to go ahead and move on to cranial nerve 5, trigeminal, and I'm going to go ahead and have you, actually, I'm going to go ahead and feel it on your face, And I want you to clench your teeth. Good. All right, I'm feeling for that muscle and that joint, and everything seemed to be intact. Also with this one, I would test for facial sensation. So I will do that later on in the video, but that is just another point to have with the trigeminal nerve. I'm now going to test cranial nerve 7, which is the facial nerve. I'm going to ask you to smile and then frown and then close your eyes really tight and open them and raise your eyebrows. All right, cool beans. So there I'm looking for symmetry. If something were to be, this test is good to use for stroke patients because sometimes they will have one side weakness and the face will droop. The next nerve I'm going over is the hearing, cranial nerve 8, and that one also has to do with balance as well. If I were to do that right now, it will come up later in the video. I would ask her to do a Romberg test. I'm also going to do a hearing test. Based on our conversation, I can tell that she hears me, or I would do a whisper test. I'm going to go ahead and do that because why not? So I want you to repeat what I say.
Blue hat. Red flower.
Wonderful. Her hearing is good. I'm going to go ahead and test nerves 8 and 9, glossopharyngeal and vagus. So I would have a tongue depressor. I can use a knife. Don't be weirded out. So I'm going to have you stick your tongue out. I'm not going to touch you, but then go ahead, say ah. Just kidding. One more time. Okay, I can tell that her uvula and her soft palate has raised, so I can tell that she has a gag reflex and all that. And the last nerve I'm going to, just kidding, I'm going to test the spinal accessory nerve, nerve 11, cranial nerve 11. So I'm going to put my hand on your face. I want you to push into my hand with your chin. Good, and the other side. Wonderful. Now I'm going to go ahead and ask you to shove your shoulders against my force. Awesome. All right, that nerve is intact. And the last nerve I'm going to do is cranial nerve 12 on the hypoglossal. I'm going to, once you stick your tongue out. Wonderful. Can you move it around? Oh, that's cool. All right. Now I want you to say light, tight, dynamite.
Light, tight, dynamite.
Okay. And you do that, you want to listen to the enunciation of the right. Is it right, tight? Yeah. Okay. The pronunciation of the beginning of each word. Now I'm going to go ahead and test motor and cerebellar system. I'm going to ask you to touch your fingers to your thumbs. All right. Fine motor function is in place. And I'm going, as she walked in earlier, I would assess her gait as well to see if she is off balance or anything. I'm going to test your strength. So I want you to raise your arms up and hold them there for 10 seconds. 1, 2, 3, 4, 10. Wonderful. And now I want you to squeeze my fingers. Woo. All right, good. So you would do those two, because also with a stroke patient, you would have one arm drooping or one side will not be as strong as the other. And next I'm going to assess her balance. Just kidding, I'll do that last. First I'm going to have you touch your nose and then touch my finger. So go ahead, nose to finger. Good, wonderful. Now I'm going to go ahead and have you stand up and we'll do the Romberg test. So I'll have the patient hold her hands at her side and she'll close her eyes. I'm going to be here for support and she'll be here standing for 1, 2, 3, 4, 20 seconds. Good. So you would test to see if she lost her balance or anything, then we would think that there is an equilibrium problem. All right, you can go ahead and inspect there. All right, so now I'm going to move into the sensory portion. I'm going to have my patient close her eyes and I'm going to test light sensation with a cotton ball. And I'm going to have you say now every time you feel the cotton wisp. Okay?
Now. 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 Now.
Okay. Now we're going to test the dull and sharp sensation. So I'm going to have you hold your hand out. This is the sharp and this is the dull. Was that really hard?
No.
Okay. So I want you to say dull or sharp each time I touch you, and I'm going to have you have your eyes closed. So here we go.
Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp.
All right. Wonderful. Oh, I forgot something. Here we go. I'm going to have you hold your hand out in front of you and close your eyes. This test is called stereognosis, and I want you to tell me what is in your hand.
Feels like a quarter.
Wonderful. Okay. So that is, well, I guess if we had a tuning fork, we'd also use that to check to see if they had vibration sensation. Typically, you would put it on the big toe, and it tests for peripheral neuropathy. If they have it, typically they won't feel the vibration sensation at all, or not as long. They'll lose that sensation faster, and typically that's the first thing to really go when it comes to peripheral neuropathy. Okay, now we're going to go into the deep tendon reflex. I don't have Emma, so this is a silicone spoon. Okay, go ahead and we're going to start out because she's sitting here. We're going to go do the knees first, the patellar ligament. So you'll go right in here on the patellar, down in between the patellar and the tibial tuberosity. However you say it. Tuberosity. Thank you. And then you're going to hit right there. The foot should kick out. Oh, I'm sorry. Did that hit you hard up your hand? All right. All right, cool beans. We got that one. Now I'm going to go ahead and have you have a seat so we can do at least the break. Okay, you want to... All right. I'll stand right here. So typically you'll have the person flex, show their muscle, and then there's that tendon right in there. So you're going to hold that tightly, and you're going to hit the finger, and you should see the fingers curl inward. I'm sorry, I'm really not. Oh. Okay, I'll take it. Okay, with the tricep, you would go back in here, right around here. I'm not going to do it, but the arm should swing out. So that's that one. I won't beat her up because I can't aim for nothing. And then I would also test the brachioradialis. Can't speak. Again, you would they would curl their arm up, right? And then I can feel the tendon in my hand, and you would again hit on the nail of the thumb, and again the finger should come in. And last is the Achilles, which you would have the foot flexed, and you would feel for the back. You would obviously feel that tendon pretty easily, and when you hit it, the toe should push down into your hand. So I'm not going to make her do that, but that's how you would see and do the deep tendon reflex, and that is it for the neuro assessment.